Welcome everyone to Insights, a webinar run by the BPS, Division of Clinical Psychology Pre-Qualification Group. Across a series of episodes, we have been interviewing a variety of people working in various roles within the applied fields of psychology, bringing you insights and reflections on the nature of their work. I'm Melissa, a trainee clinical psychologist and a pre-qualified rep for the Leadership and Management faculty, and I'm here with my colleague.
I'm Liam, I'm a trainee clinical psychologist up in Oxford, and today's episode is a special webinar recorded specifically for the British Psychological Society Careers Festival in 2023. And we're joined today by Daniela, Sarah and Ben. Guys, please feel free to introduce yourselves.
Hi, so I'm Daniela Wickett and I'm a consultant clinical psychologist working at Midlands Partnership Foundation Trust in the urgent care pathway.
Hi everyone, I'm Sarah Stacey. I'm consultant clinical psychologist and professional lead for Psychology for Inclusion, which is part of the specialist care group within the Midlands Partnership Foundation Trust.
And I'm Ben Rogers. I'm Director of Psychological Services for the same trust.
Oh, amazing. So thank you for the brief introductions. What I might ask to get us started is to hear a little bit more about the service that you all work in. I think I'll go in a different order. Daniela, you went first last time, so I'll go for Ben. Do you want to tell us a little bit about the service you work in?
Thank you, Melissa. Well, I have the weirdest answer because the service I work in is the trust, because I guess as Director of Psychological Services. So rather than bore your listeners with 20 minutes about the entire trust, I could briefly say that we are a kind of a large trust who provide mental health, learning disability services across the age spectrum. We provide some physical health care. We do also provide services, as Sarah will explain later, into prisons and sexual health and other areas. And we have a large geographical patch we cover in the West Midlands, but we also have a lot of national services. So the service for me is the whole trust, because that's part and parcel of what I support. And I sit within the corporate services, and my little analogy for corporate services, I think, Melissa, and I still need to polish this, I think, but the idea for me is a bit like when you go and see a play and the stars of the play are often the actors, who I think are like our service users and the clinicians and the staff who are really developing things. And often in corporate services, we're the folks who are running around, sorting the lights, making sure everything's safe, helping to direct in the background. So some of the services I'm around day to day are some of those background things that hopefully help to empower, the superstars of the service.
Thank you. That's great. Sarah, do you want to add to that?
Sure. So as I said in my introduction, I work for Inclusion, which is a part of one of the care groups within MPFT, the specialist care group, which covers a whole range of services. And Inclusion particularly provides services often to people who maybe are some of the most marginalised or stigmatised people in society. So we run, as Ben said, services into over 20 prisons in the UK, both mental health and, in England, I should say, both mental health and substance use services. We run community gambling harm services in the West Midlands and in partnership in the East of England. And we run some community drug and alcohol services, also sexual health, and an NHS talking therapy service. So we've got a real variety of services, and those services range from the Isle of Wight all the way up to North Yorkshire. So we've got quite a kind of disparate patch. So although the trust is Midlands Partnership, one of the things I really enjoy about my role is the opportunity to travel and to go around to different services that are scattered. Sounds a bit kind of unplanned. Scattered isn't fair, that are kind of spread around England, and the opportunity to meet staff and teams and sometimes people who use services.
Okay, and I am contributing to the delivery of urgent care services. So I've only recently started with Midlands Partnership, so I started with them in October, and I'm inputting into the liaison psychiatry services, but also have oversight for the mental health inpatient services for adults and older adults, and also into the crisis and home treatment teams here. Prior to coming to Midlands Partnership, I worked in an early intervention and psychosis service for a long time. So it's been quite a shift to come over to urgent care and to work in quite a different way.
And so, wow, that's between the three of you, seems like the trust is doing a lot of things, and you're all involved in slightly different ways. But yet, I heard right at the beginning, you're all clinical psychologists. So what advice would you give to our listeners if they're thinking of a career in clinical psychology? And this is to all of you, any of you, not directed to you, Daniela.
Do you want me to start off here? So it's, you know, the one thing that I really empathize with all your listeners is that it's not a straightforward journey if you want to get into clinical psychology. And I feel very privileged to do the job I do. I feel really happy that I enjoy coming into work, and I don't know how many people can often say that. There's always something different to do. It's exciting working with people. The opportunities to make a difference are there. But the journey in is hard, and I think even harder than, you know, back when I trained. And I think there was something for me about, you know, being yourself and finding your own place in psychology. And sometimes it can be really tempting to see there's this traditional route to get into clinical psychology that everyone has to travel. I just don't think it works that way anymore. I think there are far more diverse options for people. And we all have our own different unique journey and something to celebrate within that. And when I talk about that, I guess I'm thinking about our own lived experience as well as our, you know, the stories we bring in, not just the professional experience we get. And at the same time, it's very easy to say, but I appreciate it can be confusing for people with all these different routes. So one thing that always really helped me, Melissa, was just getting a bit of advice and grounding from people who'd walked that walk before, who are on that journey as assistants or, you know, undergrads, and getting a sense of what others were doing, because it helped me to make sense of what felt like a bit of a muddle and a bit of a mess with lots of different options. And one of the wonderful things at the moment is psychological professions are growing. There's so much more professional diversity. You know, when I trained, there was a handful of professions. We've now got almost 20. So the opportunities to go into roles like, you know, CAPS, PWPs, mental health and wellbeing practitioners are better than ever. But even some of the routes into them, you know, personally, I did lots of work as a kind of a healthcare assistant supporting adults with learning disabilities, older adults, people in care homes. And one of the things that has always stuck with me to this day is I think that's where I really grounded a lot of my values and a lot of what I thought about people in terms of compassion and care. And it's never left me. I still remember the people really vividly I worked with, because they inspired me in a sense into how I wanted to treat people and how I wanted to be treated as well. So I know I'm saying quite a lot there, and your listeners are probably used to getting a lot of varied advice, but there is something for me about walking your own walk with this and getting that advice from other people and not being afraid to try some of the new, more diverse roles, and kind of thinking about how you broaden your clinical experience and every experience as well. It's not just a stepping stone to getting onto something else. There's a lot that kind of nurtures you and feeds your interests, your values, your clinical expertise. And like I say, I still feel really privileged that I had some of those roles early on, and they helped set me off on the right path in terms of values.
And I think something you said there, Ben, in terms of the psychological professions that have increased. I think when I started off, it was only assistant psychologist posts that were available or that would help you get into the profession. But I made sure that I did support work roles as well, because I think what was really important to me was to start off with doing things that I was interested in. And then that helped build my confidence. So sometimes starting where maybe it feels like, okay, I was going to say where your strengths lie, but at that time you don't really know it's your strengths. So that's why I kind of hesitated there. But I think just having a starting point in terms of sort of for me doing support work, that then led to me sort of knowing and learning what areas I might want to go into, and doing support work, working with sort of young people, but also older people. And so from there, my interest was with young people, and that's when I then found myself in a CAMS service. And so I think it's just about developing your interests and developing your experience and knowledge where you can, and not necessarily just trying to vie for the most competitive opportunities out there. And I think that's kind of my addition to sort of my career journey onto the training and hopefully qualified life. Almost there. I'm third year, so I'm almost there.
Oh, nearly there. I would absolutely endorse what you've said, and would agree with what Ben, you were saying about, in a way, it's about what you make of the experience that you've got that's really important. And I think, you know, so often it can seem like a kind of treadmill, can't it, to get to clinical training, thinking I've got to get these particular roles, or I've got to do this in order to get there. And I think, you know, those broader experiences that you're both talking about, I would really endorse. And I think so much of the focus for me is about just how to be with people, how to be effective in being with another human and putting that person at ease, and helping to contain or sort of manage any anxiety that person might be feeling about coming into services when you work as a psychologist. I think those skills are so valuable. And I know this might not be something to recommend, but I remember in my own application writing quite a bit about some work that I'd done in a gap year in a pub, and there are so many transferable skills in that kind of work where you don't know who's coming through the door. You have to be able to strike up a conversation with people. You have to be able to think on your feet and be flexible. And I think, you know, thinking broadly, it shouldn't be a surprise, I guess, that as psychologists we talk about context, but thinking broadly about the context within which we work. And, you know, that we're going to hopefully be working with people from all walks of life. You know, psychologists work so rarely these days in clinic rooms waiting for people to come to see them. You know, we need to be working out into communities and delivering care in places where people feel comfortable and familiar. And I think that requires us to have fairly well developed skills in relationships. So for me, I think that would be my advice. And secondly, I think something about taking care of yourself is really important, but I don't want to bang on for too long. That might be a point we come back to, but I think something about self-compassion and self-care through that process of trying to become a clinical psychologist feels absolutely vital.
I'm trying to think what I can add to all of this. I guess my advice would be about enjoying the journey and not just focusing on sort of clinical psychology as the destination, because I think that puts a lot of pressure on people when they're trying to get there. And yeah, just enjoying what you do and noticing what you enjoy and noticing where your skills lie, what brings you sort of satisfaction in your work, because that's the bit that will sustain you. So working in the NHS is hard work, and you've got to find your joy, and you've got to figure out what makes that worth it, because otherwise I think people are prone to burning out and finding that really tough. And so I think that would be a big piece of advice for me, finding your joy and working consistently with your values. And there's lots of different ways of being a clinical psychologist. Yeah.
I just wonder if I can come in there as well, Danielle, because I think you and Sarah both touched on that idea of self-care, self-compassion, and that's really important, because I think we underestimate how hard it is to get onto clinical training these days. And I mean, it's always been tough, but when I think about, you know, the competition for places, and so it can often feel like the journey's about, you know, putting yourself through a competitive process rather than doing some of the things we're trying to advocate for, which is, you know, just nurturing all those things in yourself, your values, yourself, the people skills you will need. And that's hard to do. And I think there is something for me about, you know, when you're on that journey, you know, being able to, you know, be kind to yourself on the way, that it may not be immediately. You'll start to get job interviews for assistant posts when you're first out of university. It may be the first time you apply for clinical training that you don't get anything back about interviews, and that can be a hard place to be. And yet we've all had to go through that. Everyone has had to walk some of that. And so just making sure that you're kind of taking care of yourself, and possibly also surrounding yourself with people who can help you on that journey too. I'm always so inspired when I go and talk to groups of people who are looking at, the same journey, and the things they tell each other, I think, are sometimes way more powerful than anything I can bring into the space, because they're on that journey together and they're doing it at a similar time. And it's very easy to sit here and say this once you're the other side of that fence and you've been practicing for a while. But I do want just to let the listeners know, all of us who are qualified recognize how hard that is, and making sure that, we're supporting you as well. And that, where you've got supervisors or you're working in teams, or, like I was as a healthcare assistant, that, you're exploring some of that with the people around you, and them helping to, be on that journey with you and give you that hope as well. And we, I'm sure I can speak on behalf of all three of us. We're always so inspired when we meet people coming into the profession, and the skills and the energy and the enthusiasm and the new ideas and values they bring in. It's a real privilege to do that work and to support people. And I would always say, to all of you out there, never feel afraid to pick up the phone or email and reach out to someone who you might have seen on a website who works in psychology. Or, I have people contact me all the time from outside the trust, and I value that, and I will always respond to people. It's really important. It's about, really helping that next generation of clinical psychologists.
The only other thing I wanted to add, and it sort of came to mind as Ben was talking, was around that kind of being kind to yourself and not putting too much pressure on yourself to expect to know everything, to expect to have it all figured out. So I was talking with one of my first year trainees recently, who was anxious about whether they should know which direction they should be going in, what model they should be working, which service they should be heading for, and the kind of pressure that people can put on themselves to have all of that stuff figured out. And I guess another piece of advice would be just to remain open to experience, to remain open to learning, and not to feel like you've got to have it all sussed at this point in time, because you really don't. I've completely changed career in terms of direction and the type of service that I'm working in, and that's okay.
I think I definitely resonate with a lot of what you guys were saying, and particularly, I think Ben, you said about how it's easy for us at this side of the DCLIN applications to be saying that you should exercise self-compassion. But I remember finding that particularly tough, not just exercising self-compassion, but finding the motivation to do it in the first place, pre-training. And I found that personally, I've been able to exercise much more self-compassion and kindness towards myself subsequent to getting on to training, because you're kind of through that bottleneck, and it really is tricky, isn't it? But I completely agree with everything you guys were saying. It's so important, and I think it would definitely improve the journey without hindering it. But one of the things I also wanted to pick up on what you were saying there is one of the themes that came up in each of your responses was about those basic skills that you develop at the pre-qualified level, or basic is the wrong word, fundamental, I should say, in terms of connecting with other people, being able to build rapport. It's a classic statistic in psychology that the therapeutic relationship accounts for the majority of variance and therapeutic progress. But each of you have sort of gone up the hierarchy, if you like, and gone into quite managerial roles. And I wonder how the use of those skills, connecting with other people, has changed in your work now, working with systems and working with clinical psychologists working under your supervision. I wonder if anyone could speak to that a wee bit.
I'm happy to start the ball rolling, Liam, and just to say, I don't know, it has changed a lot. People are wonderful, and people are people, and some of those same skills you adapt and change, but fundamentally those same skills of compassion, containment, active listening, collaboration, they're all the same things that we use clinically, that actually we use with each other as kind of humans and colleagues as well. I think one of the things that I would say is part of this is, very few people go into clinical psychology determined to be a leader. I think often we go into clinical psychology to be a clinical psychologist, and along the way, you might get the opportunity to do more leadership. Or for me, it was a very values thing about recognizing that by working with teams and systems, I could start to have an impact on, bigger communities. And that fed something in me. It was really important. And yeah, one of the things that was so important was, for me, I think you know, as you develop as a leader, there's a lot of wonderful leadership tools and skills you can learn. If any of your listeners are interested in this, the DCP's got a really good leadership framework that talks about all of us, regardless of our position and role, having a leadership role to play. And yet you can have all of that knowledge, and if you can't work with people to use those models and ideas, it's a really difficult place to be working in leadership. So I would say, Liam, a lot of the same skills apply. And if anything, I think sometimes as a leader, I'm just as challenged to really come back to my values as I am when I'm working with clients. And I still keep some clinical work. I've always really valued that. But, you know, I do feel a lot of the skills we bring in as clinical psychologists relate to that. And some of your listeners might be sat there thinking, well, I don't know if I relate to, you know, other leaders out there. You know, I don't know if leaders look like me, sound like me. And actually, there's something for me about trying to get past some of those barriers and help people see the leadership skills they've already got and learn to embrace those.
Thank you, Ben. Did anyone else sort of have any input on that?
I was thinking about my own leadership journey, and it's been a very slow evolution. It wasn't necessarily a grand part of the plan. But I was working clinically, and as gradually services expanded, and I gradually started having to supervise and be responsible for other people's work. And it's been an evolution over time. And I think it only occurred to me quite recently how important kind of a leadership role was for me, because the reason I left my old job, which I absolutely loved, was because I missed out on a promotion within my own service. And the thought of not being the lead for that service, of not being the one that does that stuff, just felt unbearable. I couldn't stay. And it was actually a catalyst for then seeking out a new role. So I don't think I'd realised how much that stuff mattered to me and how important that was until that was taken away. But yeah, I actually really enjoy being able to help others develop and to shape how services are delivered. I love going in and doing teaching at the universities. You know, I really enjoy engaging with trainees and hearing their feedback and being prompted to think differently. So yeah, those kind of roles are really, really interesting. And it's not necessarily something you necessarily go out and seek straight away, but that's certainly something I've grown into.
I was just thinking, listening, it's really interesting listening to Ben and Daniela and those reflections. And I think I almost feel that I use those skills even more now in this leadership position than I did when I was a full-time clinician. And I think there are differences obviously in these roles. And I suppose what I notice is that every day I am needing to, whether I achieve it or not is another matter, that's probably another conversation. I'm needing to deploy those skills to be effective in my role, whether that's about showing that I understand a colleague's perspective when we've got different views on things, or whether it's trying to support somebody who's having a difficult time, whether it's trying to move a project forward, trying to influence in a way that, you know, that sort of serves the services that I work within. I think all of those core skills that we were talking about how to build relationships and how to, you know, how to empathize, how to demonstrate all of those core qualities. I absolutely use those almost now than I ever have, I think. And something was coming to mind about the kind of the power that we have in the relationships that we have. And I think, while, you know, we talk a lot about being mindful of power in the therapeutic relationship, I think I also tried to be really mindful of power in this leadership role. And I think holding that lightly means that I need to deploy those skills particularly skillfully, I think, to recognize the impact of that and to be able to build effective relationships with people where it doesn't feel like I'm just trying to pull rank in some way. That feels a clumsy way of saying it, but I think that feels even more important to pay attention to in my current role because it's talked about less, I think.
Thank you. So many thoughts going around in my mind. But I guess I was just conscious of who our listeners could be, and they may be so I guess we're talking from the perspective of clinical psychology, and they may be at a point of being unsure of whether it's clinical psychology or a different type of psychology. And I just wondered, could either of you, or maybe between the three of you, almost give a description or an explanation of what you would say clinical psychology is, or the role of clinical psychology is?
So
No right or wrong
mean feet then.
answers.
Well, yeah, we'll just do this in a couple of
no
minutes.
no right or wrong answers.
No, it's great, Melissa. And I guess, you know, when we can all contribute to this, but to start with, you know, clinical psychology for me is about the application of psychological principles within kind of healthcare settings and for those who may have a range of needs. And of course, we're not the only area of psychology that does some of that. So we also have health psychology, neuropsychology, forensic psychology, who are kind of sister professions within it. And we often talk about clinical psychologists as being scientist practitioners, and that is still a really important bit for me about how we take kind of psychological and evidence-based models, apply them in our work, and also evaluate the use of them. And the thing that your listeners will know, and I'm sure they'll have been, you know, learning about in lectures, reading in books, putting into their applications, is some of the core principles about, you know, how we assess and understand a problem to start with. And that could be from a whole range of perspectives, how we take that forwards in building an understanding or a formulation. And I guess that's really about helping to make sense and to get meaning from things. And I guess in formulation, the key thing for me is that they're all driven by a service user. As a psychologist, I'm there to support and walk a mile with them. But actually, I want that understanding to be something that really comes from them with us working as a team rather than being directed by me. And then it may be we deliver intervention as well. And sometimes an intervention may be no more than doing a formulation and developing an understanding. But I guess sometimes as clinical psychologists, we do therapy. And actually often I think if you ask people about what does your typical psychologist do, probably on the telly, the stuff they'll have seen is people doing therapy. And that is a great, wonderful bit of what we do, but it is a small, you know, it's a section of it. And I guess then there's something for me in clinical psychologists as scientist practitioners about when we've done some of those things, it's about being able to then generate the evidence that we've made a difference. And again, for me, you know, I'm really passionate about participation and you know, really working shoulder to shoulder with service users. And as Sarah said, sharing that power. And for me, again, evaluating that has to be, you know, really led by service users and done collaboratively, because they're the ones who have that knowledge. I can look and I can observe, I can ask them about what's happened, but I want them to feel in control of bringing to me, you know, what's changed, Ben? Here are the things that are working well, and maybe there are things that still aren't, and we have to think about together. So there's some of the fundamental bits, but I guess, I mean, it'd be interesting for Sarah and Daniela as well to bring in. I think there's a whole range of other stuff we do within clinical psychology that certainly doesn't get as much airspace as some of those kind of fundamental things.
I was hoping I could just say what Ben said, because I think your answer was really comprehensive, Ben, but I'm going to have a bash at adding some additional bits. So I think for me, and if I think about when I have these conversations, you know, working in prisons, quite often I have conversations with aspiring psychologists who are trying to decide between forensic or clinical training, as an example, and we sort of weigh up the different trainings and what they might look like and what potential roles can be post-qualification. And I think one of the things, and it sounds trite and I don't mean it to, is that clinical psychologists are real chameleons. I think one of the things I love about the profession is that we can do so many things. We can wear so many skins, and I think we inhabit them all fairly comfortably. I think one of the great things about training these days is that it equips psychologists. You know, Melissa and Liam, you no doubt will be getting much more training in leadership and strategic thinking about systems, thinking about the NHS, or all of those things than probably we did when we trained, because I think there's much more focus these days on those wider skills of clinical psychologists. And I think everything that Ben said absolutely applies. But I think also we can find our way into places that perhaps other psychological professions don't have such easy access to. I think, you know, when I think about my work, I was talking to colleagues the other day about how we have to be really business savvy now, particularly in leadership roles. We have to work effectively with our commissioners. We have to be aware of funding pressures and all of those other things that I didn't particularly expect to do. That certainly wasn't the reason I went into clinical psychology. So I think we have so many other skills that we develop probably after training as well. And I think those kind of roles that we pick up, we come out of training. I remember somebody saying to me, your knowledge will never be as broad as it is at the point you qualify, because you then begin to kind of funnel and specialize. But for me, definitely, it's like training has continued in the time since I qualified, because each of these other opportunities has come up. So I think we are also leaders and managers and, all of those other things that we've kind of alluded to. It's great, so varied.
And I think the role has probably evolved over time, the role of a clinical psychologist, and very much so on the training course that I'm on. There's a leadership aspect to it, in terms of, Ben, I think you mentioned the leadership framework that the DCP has. So, we're taught that, and we're, given opportunities to learn how to develop leadership skills or identify opportunities within the position that we're in at the moment as trainees. But from that, what I've also noticed is that even if I wasn't on training, there's times where I've probably had opportunities to use leadership skills or develop my leadership skills. So I guess, again, thinking about those who are not yet in training, maybe at the early career stage, thinking about the experiences that you've got already, or depending on what job. So you might have come from a non-psychology background, and you're bringing all of that, you're bringing all those skills, you're bringing all of that leadership knowledge and awareness. So I think that it's just important to just, as you were saying, that's what came to my mind. And then also something that I think you said, Danielle, in terms of teaching on the university courses. So again, if you're coming from a non-psychology background and you're thinking, how can I get into this career? Maybe I haven't got the same skills or experiences. It's quite transferable, and there's ways that you can use it. There's, like you said, it's such a varied role. So yeah, I don't know, you can sort of add to that if you wanted to, but that was just what was going through my mind.
I mean, I really valued the depth and breadth of like what you're taught in clinical training, those abilities to use those skills in so many different ways and in so many different roles. And I really liked that about clinical psychology, that there was just lots of ways to be a clinical psychologist. And I think it depends on the service that you go into. It depends on the sort of role or level that you're at. So band 7s will often end up doing a lot more of the direct clinical work. And there's lots of people that go into clinical psychology because they really value that. And I know that that's a part of the role that I've really enjoyed. And I guess as you move further up the sort of hierarchy, that gets less. But there's lots of different ways of being a clinical psychologist. And clinical psychology isn't a million miles away from counselling psychology. And I think sometimes we like to position ourselves as incredibly different. I think some of those differences might be more personal differences than they are professional differences. And increasingly, we're seeing counselling psychologists come into clinical roles that would have historically been clinical psychology roles. So I don't think that necessarily clinical psychology is superior to, it's just different, and the training's different. But yeah.
I just wonder if I could add in as well, and really helpful descriptions and adding to this, because the one thing I observe at the moment is the evolving nature of all the psychological professions. We've gone from this relatively small group to a really big group, and that changes the nature of what we do collaboratively and independently. So the role of clinical psychologists in terms of training and supervision and support and nurturing those other psychological professionals is bigger than ever. And I do think for people going into the profession now, some of that is changing. There was a time when I was applying and probably we were doing a bit less of that. There was some of that out there, whereas now that's happening. And I don't know if it's because, we are in a relatively privileged position in services because of the training we come in with. But I love Sarah's analogy about the chameleons. And the other thing that kind of strikes me there is just the rapid nature of where that changes. I love working in a role where I can do so many diverse things and work innovatively. And I think there's a little bit of a natural rebel in a lot of clinical psychologists, that sometimes we are trying to push boundaries, do things differently, and always in a safe way for our service users. But, you know, sometimes I think big organizations like social care, the NHS education, they need some people who are willing to try different things and to be innovative and to push boundaries. So maybe one of the nice things about the role as well is there's a bit of, you know, if you do feel, you know, sometimes you want to do things differently and try new things, there's so much, you know, variety in what we do, and the different types of role you can do. You know, there's something for everyone within there. And aligned to that, I guess, that goes broader than just clinical for me, because that's just within clinical itself. But now when you think about almost 20 psychological professions, you know, whatever your passion is, there's a home for you within those psychological professions, and something that will, you know, I think give you a lot of joy at work.
I think that's really, really lovely. And yeah, I definitely agree about that natural inner rebel. That really rung true with me. And I've been well, getting myself off to sleep quite easy with a statistics book recently by R.P. Ewelson, and it reminded me of something I was reading the other day in his work, where he was saying that, you know, if you should be doing things differently, and not everything different is going to be good, but everything brilliant is going to be different. And I think there's something in that, isn't there, with clinical psychologists, that they push the boundaries, they try to do things differently, and that is the seed of creativity that can grow into really incredible things. Now, not to dampen down the mood or anything like that, but we've talked a lot about all the wonderful things about your roles in clinical psychology. But of course, as alluded to earlier on, it's a really hard role as well. There are some challenges on the day-to-day. And I wonder if you could give our listeners and viewers a bit of an insight into the kind of challenges that you guys face on the day-to-day in your work.
Being really gobby and going first, so I'll continue that trend if you want, but it's, yeah, okay, thank you. Yeah, I mean, it can be a really hard job, and I think Sarah and Daniela have alluded to that need for self-compassion. And, you know, I genuinely feel privileged and love working with people, and that is what makes the job wonderful. But it can also make it really hard sometimes when you're working with people who've had incredibly difficult experiences, and that can sometimes touch things in ourselves that connect to our own experience. Sometimes it can be the sheer overwhelmingness of hearing someone's story. And so there's a real need sometimes to make sure you're being self-compassionate, you're using your supervision, you're just taking good care of yourself within that. And I think there are other things that kind of play into this as well for me, because in a way, I think beyond that, there's a lot that's changing for us in terms of, you know, the profession. And one of the biggest challenges for me, Liam, is also one of the most wonderful things, which is with so much change going on, it's almost like, where do we start with this? You know, the world of psychological practice is going like this. So on the one hand, that's a really exciting thing, but on the other hand, that can be stressful and anxiety provoking. It can be difficult for services when lots of new ideas are coming in. And your listeners may find that when they're in services and doing jobs, that, you know, regardless of the role you're in, you experience some of that. And I think kind of finally connected to that for me is that experience of having been around healthcare during a pandemic, and with the after effects of that, with the, you know, seeing, you know, we work for the NHS, and I love the NHS. I feel privileged to work for an organisation that, you know, still provides healthcare free to people, regardless of, you know, where they come from. That's really important to me. But it's, you know, there's a lot of challenges for us within that at the moment, and that can bring around stress within services. And again, sometimes that brings around the most wonderful creativity and doing things differently. Sarah alluded to the idea of being business minded and doing things in a different and innovative way, and bidding for new things, which can be exciting. But, you know, as a system, that can be stressful and difficult. So sometimes I think, you know, being able to work within that means, you know, it does mean being able to look after your own needs as well as others. And we often talk about the idea of self-compassion being, you know, compassion starts with the self, because it's difficult to be compassionate for others if you can't be self-compassionate and get in touch with that first. I could also flippantly move from something quite meaningful to saying time, be lovely to have a lot more of that. And that's, the same for all of us, isn't it? But when you've got so many things going on, trying to cram all in that into one job sometimes is really difficult. But that's probably further down the list of priorities for me compared to the other things.
I guess in reflecting on some of the challenges that I've experienced, I think sometimes working within systems, particularly very strained and resource constrained systems, and that we can want to do certain things and we can see certain needs, and it can be really hard for those to be met in a way that feels meaningful. And that's challenging because, we'll have our own sense of values, we'll have our connection with the client, we'll have our sense of what might help. And it just might not all join up in the way that we'd like it to. And that can be really, really hard. And sometimes you have to kind of let go of things and just hope that people are going to be okay, not knowing whether that's the case or not. And that's really hard. Sometimes, I'm now in a system where I'm working between physical health and mental health. And there's different kind of cultures within those organisations. And that's interesting, but also challenging. And we've got different priorities around what's important. So physical health settings are really, really stretched right now. And they've been through the most horrendous time. And maintaining compassion when you're under such intense pressure is really hard. But that may not be what the people coming into those services need right now. And so kind of how to create those compassionate cultures when there are such intense pressures is a real challenge.
I think what Daniela was just saying, I would absolutely echo. And I think for me, one of the challenges is the gap between intent and reality. I guess, we know none of us are unaware of all of the kind of good practice guidance and research evidence about what is effective and helpful. We know that compassion is hugely important in healthcare. We know that has a direct relationship with experience and outcome. And yet, as Daniela and Ben have said, we work in incredibly stretched systems. So I think for me, the big challenge at every level has been that gap between what we'd like to do and what we're able to do. And I think that's a real challenge. And that's where that need for the self-compassion, first of all, comes in. And I think that's where we can be useful to teams and to services and to systems. If we can kind of figure out our own position in relation to that and hold a compassionate position towards ourselves, doing what we can, doing our best, but not losing sight of ourselves within that, I think we can help others to find a way to do that. So I think for me, I would say that's the big challenge for now. And just working in the NHS, I think systems are stretched. We're in, we've heard a lot about unprecedented times, yada yada, but that's really true. And so I think that we need to use those skills and kind of resources that we've got more than we ever have, probably.
Thank you for that. When I was thinking about challenges, I was also wondering about the challenges that we might face again at that early stage career, but I guess even at your stages. So self-compassion and self-care is important. But I was also thinking about, for me, something that really helped was connecting with others, finding those spaces, finding those platforms, or even if it's just another person. So at the time, it would have been another AP. So I really valued that. And I think that's what helped my journey, especially when I was getting disappointing rejections into the career, whether it be a job or whether it be the training. So I guess, how important is it to you guys, or what do you guys think about networking and sort of finding support in other ways, as well as the self-compassion?
I'd say it's really important. I remember being an AP and kind of at the time, there was quite a few within the service that I worked, and having that network of people around me that are in a similar position who were supportive. It didn't feel competitive between us, it felt supportive. And that was really, really important. And being a trainee, the thing that got me through my training was my cohort, and the relationships that we had, and going to the pub after training. Those are the memories I have of training, that the relationships and the connection and the support, even though training was hard. So I think that's just really, really crucial. And I guess there's more options than ever now for how people can connect and support each other, and social media and sort of all these groups that now exist. There's loads of opportunities for that stuff, and I think it's really crucial.
And just you saying that, I think as well, mentors, there's a lot of schemes in terms of mentoring now. So I think that can be helpful too.
Yeah, no, I was just going to agree. I think mentoring and just making those connections. I think Ben talked about it right at the beginning, and it can be really hard to take that first step, can't it? To ask somebody for some time, or you know, to make a link. But my encouragement would be to everybody to do that. I know I find it so valuable. You know, I have a monthly catch up with Ben as the director, and I cling on to those sessions slightly like a little island in my month. But you know, I also have other resources, other kind of groups and people, and I think I've learned as I've gone on through my career how important those are. I think there've probably been times when I've tried to be a bit of an island, or that sort of scarcity thinking about, oh, I've got to do this on my own, I've got to prove myself, that coming from a place of threat almost, of, you know, I can't reach out, that demonstrates something negative. And I think I've kind of flipped that on its head over time, and will kind of seek out those supportive, collaborative relationships professionally wherever I can these days. And I definitely feel stronger and more resilient for doing that, I think.
There's something really important for me about kind of who you reach out to as well. And just to say, it's really nice what Sarah was saying about kind of those connections remain important. And I think we all still use them. All of those islands for all of us are mutual. You know, it's very rarely a one-way thing. One of the frustrations for me, I guess, at the moment when I talk to people trying to get onto clinical psychology is, I alluded to it before, this idea of, you know, when you look at psychologists on telly, what do they look like? Who are they? And if you're looking at those people on telly and thinking, well, I'm not like that, they don't look like me, they don't talk like me, they don't look like they came from the same place as me, people tell me it can feel really difficult to get a connection with that, and this idea that, well, that's what you're supposed to be. And that's not at all what psychology needs. Psychology needs us to have a kind of a reflection of the whole of our, you know, community. And there is something for me about when you're connecting with people, not feeling like you have to connect with a certain type of person because they look like what you think a clinical psychologist should be, or they're doing the kind of stuff that you think a clinical psychologist should be doing. You know, connection can be with all of the people in your team. It can be with your family, your friends. And when you're reaching out to people who are already within the profession, you know, don't be afraid to go out there and try and find with people who you connect with on a personal level. And just like when you're connecting with people therapeutically, there's all that stuff around, you know, that containment and support and nurturing. But I think there's something for me about being brave and getting out there and connecting with people and putting yourself out there sometimes and looking for some of those folks that you might connect with on a personal as well as a professional level, because maybe there's some of the people that might not just serve to inspire you, but also help you to kind of think about what it was that they did to get in, what's important to them in their work. But yeah, it's a really, really important bit, Melissa, is that connection. And I guess it would be remiss of me not to say that, you know, this is a BPS thing that's going on here, and there is a role for those kind of professional bodies and groups. And of course, the BPS isn't the only one of them. There's lots of different ways you can connect with people. And I've heard lots of wonderful stories about pre-quals and, you know, folks who are applying for courses or trainees who are kind of connecting with others through those communities as well. And Daniela said some wonderful stuff about some of the online community. And you know, that's great too. But, you know, connection doesn't just have to be the traditional ways of someone in your team or service. It could be drawing on all those other kind of really wonderful connections. And hopefully some of the people who are going to be listening, Melissa, might feel inspired to kind of get a bit more connected to some of the BPS stuff and some of the things that are going on.
I'm really, really glad that you mentioned that there, Ben. And that's something that Melissa and I want to really emphasize, is that there are so many resources on the BPS website for people looking to get into clinical psychology, but other areas of psychology as well. And beyond the BPS, across the internet, on YouTube, there are loads of resources out there. And we're aware that there are some people, or services, I should say, out there who will charge to help people with applying for training and that kind of thing. And it's Melissa's opinion, it's my opinion, that that's not necessary to get onto clinical training. And we thought that might be a nice thing to sort of mention here. So that's very sadly all we've got time for today. Thank you so much, Ben, Daniela, and Sarah, for joining Melissa and I today. I know that I've learned so much, and I'm slightly overwhelmed with the number of thoughts and questions I've got through my mind, and I'm only sad that we have to end here. But it's been such a pleasure having you all on, and thank you for being a part of this special webinar for the BPS Careers Festival.
Oh, thanks for having us.
Yeah, thank you all, and just a massive gratitude to all the listeners as well for putting the time in to listen to this, and just want to wish all of them the best in their journeys as well.
Absolutely.
Thank you all.
Brilliant. Yeah, Ben, again, doing my job for me. I was just going to say thank you all to those listening at home, and we hope to see you all in the next podcast.